Well, howdy YouTube family, it's Bolt CRNA coming to you again with another day's topic. Today we're going to talk about negative feedback. All of us have gotten feedback in our life, whether it be positive or negative. When you're in training for something like CRNA or whatever else you're in training for, you know that you're going to get negative feedback. You're going to get feedback that what you're doing is wrong and you messed up and you need to improve. So in anesthesia school, you are going to get a lot of feedback like that. So you have to become really good at how to deal with those times so that it doesn't destroy you. Let's talk about how I dealt with negative feedback. Not all feedback is made equal. Some negative feedback can be constructive. Some of it can be, you need to improve on this, or next time you should do this differently, and that's good. Things need to be pointed out to you when you're not doing them well or doing them as good as you should have done. And that way you can continue to work on that stuff. How do we grow and continue to flourish in our profession or anything in life without having feedback letting us know, hey, this is something you need to work on? The other side to that is, sometimes feedback is not constructive. Sometimes feedback is not helpful. Sometimes feedback is not fair. Sometimes that person is just having a bad day and you're getting on their nerves and they're giving you toxic feedback. I like to call it toxic feedback because it's not helpful feedback. It's actually almost like bullying that's going on. They're really pressuring down on you. Maybe they're standing over your shoulder. Maybe they're telling you, constantly berating you or making you feel bad because you didn't put the tape on the machine the way they like it to be put, or basic things that are not really important to the real patient care or to any process that you're actually doing, but mainly like what they just prefer, or maybe it's just something with their personality you're not doing correctly. That's toxic feedback. That's the kind of feedback, and sadly, in medical training and anesthesia training, CRNA school training, things like that, I know from lots of people in those training systems who've talked with me, that feedback is very common. It's something you deal with often. It's something that you have to get good at dealing with and understanding so that it doesn't destroy you. Because if you internalize every time someone's saying something to you rudely, or every time somebody is just giving you feedback in a way that's not going to help you but actually just kind of harm you and mentally hold you down, if you allow that to really internalize and just like hold on to it and believe it, that can actually harm you from being able to continue to grow as a provider and continue to grow into the CRNA that you're supposed to be, or provider you're supposed to be. So how did I deal with it? I went into every interaction with, whether it be a professor or a clinical preceptor, with the idea that this person is a human being just like me. This person has bad days. This person has bad years sometimes. And sometimes this person is just very jaded and has been for a very long time. And so you have to keep that in mind when somebody's giving you feedback, or even it's just body language that you're picking up on, and just general the tone of voice and things like that you're getting, the vibes you're getting off this person is not positive. You're getting this sensation of like either they don't like you, or you're such a failure that it's like bothering them that you're with them for that day, or they're having to teach you, or you've made a couple of mistakes and they really have just like laid into you about how terrible it is that your mistakes are here, or that you're behaving like someone who's never done any training at all, and just a lot of toxic kind of words to you that are not helpful, that are definitely way beyond what was necessary to correct you or to help guide you into into correcting in the action that you're doing. And then they went beyond that to a place where it's just being mean and hurtful to you. That's something you're going to deal with. So how did I deal with it? I understood that this person is a human being. Sometimes what they say is not true. Sometimes what they say is tainted by their own perspective or their own situation they're dealing with. I had skin like Teflon, is how I would describe it. I could allow things to bounce off me and repel feedback that I did not feel was helpful or constructive. Now, be careful here. You don't want it to be so much so that you don't accept feedback that you actually need. If you keep missing all your intubations over and over again, or you are pulling up the wrong drug for the wrong time and things like that, those are all times where you need to be accepting feedback and saying, okay, they're giving me feedback saying I'm not doing well, and I am not doing well, and I need to change these things in this method. If they're screaming at you or cussing at you, or maybe even pushing you or something physical, that's feedback that you need to learn to put the Teflon on. You need to go ahead and slap that Teflon on and let that bounce off of you, because that's not stuff that you can let hold on to you. Because if you do, that's when students break down. That's when students go into the bathroom and cry. That's when students go home at the end of the clinical day feeling like they're no good. They don't need to be where they're at. They don't belong in this training program. They don't belong. They don't deserve to ever get to become an anesthesia provider or be a CRNA, because they did so bad today, obviously from the perspective of that clinical preceptor, that they may be dangerous to even deal with patients. So maybe they should just quit school or something like that. I can't tell you how many times I've had classmates who have had that interaction or experience, and they've come to me as a friend and wanted to talk and things like that. And I realized, wow, this person, they're totally tore up about their role, about their career, about their future. They can't eat dinner. They feel sick to their stomach. They wonder if they're in completely the wrong field. And I've rotated with that person. I know them as a person. I know them as a student in class. I know them as a clinical student who's been rotating with me. I've seen them do great work and stuff. And I know that that's not true, that what they're internalizing or feeling is not true. And it's so easy to let those negative words and negative feedback really just sink into you and just take root and let it affect your mind, and it even affects your performance. It's almost a snowball effect. So now they've told you that horrible thing about how terrible you are and how you're no good, or you don't belong in that program or to be a CRNA, and now you've internalized that. So now you're actually going to be nervous and shaken the next time you have to go and start an induction process or do something else with patients and stuff. You're going to be worried that maybe they're right. Maybe you're going to make a mistake again. And now you're all in your head. You're not focusing on what you're doing. And then you're going to do not as good as you should have done again. And then you really start thinking, oh, they're right. They were totally right. I am no good. And it's a self-fulfilling prophecy. So now you're actually allowing someone's negative words that were not fair to you to actually affect your performance, the way you're acting and the way you're interacting with your patients, and your anesthesia performance and your training and your future profession and goals. You're letting that person affect you on a heavy, heavy level. And I don't allow anyone to speak into my life that I don't give permission to speak into my life. And I think you have to understand that when you first start clinical training, or anything, even academically. Sometimes professors will say things that aren't totally fair, but usually your professors are a lot more on your side and wanting you to succeed and excel, versus maybe a potential clinical preceptor you're meeting that day that doesn't know you or is invested in you and is actually just being tied to you for the day because they have to. They may not even want students ever, but are being told they kind of have to take one. So that's the kind of person you definitely have to step into that environment with, knowing I am going to allow you to I'm going to give you permission to speak into my life if they earn that. If they don't earn that, don't give it to them, because that ability to speak into your life and to allow something to be internalized on you and to allow something to affect you and who you are as a person, that's a very important thing. That's very valuable, and you don't just give that away to anybody. So when you step into that clinical environment, you have to know, like, I'm gonna interact with you today and I'm gonna learn from you, but that doesn't mean you've given them the right to speak into your life yet. So there are some clinical preceptors that I worked with who, over time of working with them multiple times and me realizing this person has good intentions, this person loves teaching, this person wants students to prosper and grow and do well, and this person has my best interest at heart for the most part, I then would give them that permission of like, hey, speak into my life. Like, Tell me what you think. What do I need to grow on? And those are the people who become like mentors to you. Those are the people who help you grow in ways that the other people who just precept you for the day and move on or whatever, they don't really have that ability. And those are people who I continue to keep in contact with today on social media or use as references for jobs, and people who actually are even now, a couple years later after I've graduated and out, halfway across the country, they're still interested in whether I'm getting a good job that I want to work in or I'm doing well in my practice, and they keep up with me. So there are certain people in the clinical environment that you can, give that permission to, and you can grow a lot from. And there was one guy in particular I'm thinking about who was ex-military, and he was very tough. He was an extremely tough CV anesthesia provider, and he was very good, very smart, but he was also very tough, very blunt. But I knew he had good intentions, and I knew he was invested in me being the best that I could be. So I let him speak into my life, and there were a couple times he spoke harshly. And sometimes that's okay. It's okay if someone speaks harshly and you really feel that and internalize that and say, wow, I should really remember that dosage of this thing or this reversal agent or the binding of this medication goes on this site, whatever it is that you forgot in the moment that they like harshly let you know, like you really disappointed them and that's not acceptable. Internalize that and just understand, like, I'm going to remember that certain medication for the next time. And you know what? I did. Every one of those events where I was like, man, that was hurtful because I allowed him, he holds a special place in my mind of someone that I look up to, and he was really disappointed in me for not remembering this or not doing this correctly. And all those things I'm actually very good at now, and I actually remember off the top of my head all the time. So those are ways that kind of feedback can be very positive, and you can have a really good interaction with a preceptor in that situation. And lastly, know who you are. Understand who you are as a person. Have a strong sense of self. That doesn't mean be arrogant or prideful, but it does mean understand who you are. Understand your self-worth. Understand who you're not. And that way, when people speak things to you, because people will try and tell you who you are, and especially when you're a trainee and you're being shaped and molded constantly for 3 years, you're being broken down like clay and molded back up again. If in the core of you, you don't have a strong sense of who you are and what you bring to the table and your value, when they're molding you and breaking you down, they're going to snap your core. And that is going to rock your world, because you're not going to have a foundation of your value and what matters, and then anybody can speak into your life. Then the people who don't have good intentions, who are not someone you should allow to speak in your life, will speak things that are not great, and it can really rock you. So that's what I noticed about other SRNAs, my other friends and stuff, who maybe had issues with self-confidence, or maybe came into the program already feeling like maybe they weren't a great nurse, and maybe they're not smart, or maybe they're not very good at this, and all these kinds of negative self-doubt talk. If you do that and then you start this program, there's going to be a lot of negative talk people are going to throw at you. And if you don't know how to reflect that and understand who you are on the basis core of a person, they're going to break you. And it's going to be painful. So I give you that advice. Know who you are. Take negative feedback with a grain of salt, and understand that some people are just having bad days, and some people are just kind of mean people. Life has done some stuff to them, and they've come out as kind of a harsh person. And that doesn't mean that's something on you that you need to take on. Well, all right, that was my big brother talk with you guys. I hope that it was helpful. I hope that all of you out there who are maybe in nursing school, or maybe in high school, or any, military training, whatever you're doing, essentially you're going to come across situations that involve this topic, involve people training you and molding you and teaching you, and knowing how to not allow everything to really sink in deep, and know when it is time to allow someone to speak into your life and really make a difference for you, because that can be a really positive thing in your life. Of course, I want you to subscribe, hit that subscribe button, smash it, punch it, whatever you want to call it. hit the like button, and go over to my Instagram. It's CRNA over on Instagram. Follow me over there. I do a lot of lives. I try and do daily stories, keep up with you guys, post pictures about what's going on day to day in my life. So you can follow me over there, and sound off in the comments below. I want to hear what you guys think about clinical preceptors and allowing people to give you negative feedback and how you dealt with it when you were in school. You know, be honest. If you just cried in the bathroom every day, tell the truth, because trust me, I had friends that was their way they coped with it. They never quite grasped the way to do it, except maybe at the very end, maybe they got better at it. But anyway, let me know in the comments below, and that's Bolt out.